Good evening, and welcome to the first and hopefully one of many episodes of PENT Cast, where the physicians and audiologists and other personnel from Plymouth Ear, Nose, and Throat try to bring to the community and our patients the latest in scientific innovation and discoveries that may have some significant measure of change in your life for the better. So with me today as our heart and soul of our audiology staff, all these nice young ladies. I'd like to introduce them to you. First we have Dr. Unyan Wong to my right here. Dr. Wong has worked with Plymouth Ear, Nose, and Throat since 2013. She's a doctor of audiology and received her degree from Northern Illinois University. Dr. Megan Lewis to my left has been with us since 2017. Again, doctor of audiology and a recipient of her degree from the University of Connecticut. Dr. Ariana Glide, doctor of audiology and with us since 2021, graduate of the University of Connecticut. And last but not least, newlywed Dr. Colleen O'Dwyer-Wimmer, with us since 2023, and graduate of the University of Massachusetts in Amherst. Thank you all for coming tonight and sharing your knowledge with us. Tonight we want to discuss a number of recent articles that have appeared in the literature, and these episodes of PNT Cast basically are a distillation of our quarterly journal club meetings where the entire staff gets together and goes over the pertinent research that's come up in the literature of late. So there's a lot of exciting things that are around these days, particularly the way amplification affects very important hot topics today, including cognitive impairment, tinnitus, and just a host of things that affect people on a daily basis. So without further ado, we'll start to review these pertinent articles, and I'll begin with Dr. Wong, and I'll let her present her topics, and then we'll be discussing these as we go, and just jump in and we'll see what kind of conversations we can bring to the public.
Okay. I'm going to review an article. The title is The Impact of Hearing Aids on Listening Effort and Listening-Related Fatigue, Investigations in a Virtual Realistic Listening Environment. Actually, this article has been published in Germany. And the aim of this study is to develop, actually they are stable tests to measure listening effort and listening-related fatigue, and to evaluate the influence of hearing aid use on both conditions of aided and unaided in mild to moderately hearing impaired participants. So I'm going to start with the background first. The people with hearing loss have difficulty hearing and understanding speech in background noise situations, and they have increased listening effort compared to normal hearing people. Also, they have increased mental effort when they are in challenging listening situations in order to compensate their hearing loss. In this study, short-term fatigue, which follows demanding listening situations, was investigated. It is listening-related fatigue. Several studies investigated people with hearing loss experience more listening-related fatigue compared to normal hearing colleagues. And they found that people with hearing loss are more likely to have a workplace accident and take more sick leaves and more risk to have depressive symptoms. In this study, 20 experienced hearing aid users were participated, and their hearing loss was a mild to moderate sensory neural hearing loss. And all participants were fitted binaurally with Phonak Audio Marvel 9 hearing aids, which is premium hearing aid levels. This study is to evaluate a hearing impaired person's everyday life listening inside in a lab using virtual situations and virtual acoustics in aided and unaided conditions. And they used 5 different acoustic scenarios with 4 different listening test paradigms in 2 free fields. And no background noise, and cafeteria background noise, and quiet home situation with soft background sounds, and radio with the traffic news background with the speech from different room, and public house background noise, and living room situation with the radio traffic news from a different room, which is a kitchen. So participants were tested using German speech test. Speech sentences were presented in front of a speaker, and background noise were presented from 12 the speakers around the participant. And participants were asked to repeat the name and object of the last 2 sentences, and they react as quickly as possible. The whole test was in either unaided or aided conditions. And when we look at the result, and they measured subjective ratings of listening effort and the listening related fatigue for both the unaided and aided conditions. Overall listening fatigue, overall listening effort was high scores across all tests, but listening effort scores were significantly lower when using hearing aids. And listening-related fatigue increased in both aided and unaided conditions through the whole test compared to the start point. However, at the end of the test, there was a significant difference between ratings with hearing aids and without hearing aids. It was much lower with hearing aid conditions. And second result, a reaction time. And reaction time was measured in aided and unaided conditions, and there was no difference between them in 4 situations out of 5 situations. However, reaction time was significantly faster in aided condition for the cafeteria background noise situation. And they also measured word recall accuracy in aided and unaided conditions. The response accuracy was significantly better for the 2 situations, which are public house background noise situation and the radio with the traffic news background situation. And on other test result, they also measured attention and the concentration perforation before the test and after the test. There was no significant difference between pre and post test. No significant difference between in aided and unaided conditions. The last result, which they measured stress hormones 4 times using saliva samples before the test and twice during the test and the last after the test. There was no difference between conditions in aided and unaided situation. And this study shows their protocol and their test tool is appropriate to evaluate listening-related fatigue. And a big take-home message is fatigue was significantly lower when they use hearing aids.
So for an elderly person, Dr. Warren, how would this translate into quality of life issues for that person if they're significantly more fatigued just from the mental effort of keeping up with a conversation or trying to listen to their family?
So oftentimes I do hear from my patients, they feel so tired at the end of the day because they have a lot of conversation and group situation. Usually when they are in social situations, after the day, they exhausted because they need more listening effort, and that's gonna make them so much kind of listening related fatigue.
I'm going to pick on you next, Dr. O'Dwyer. So what have you, in your patients, I know you deal with a lot of elderly patients as well, the listening fatigue we're talking about here from trying to deal with background noise and other family members. I know we see people often quite frustrated, not only the family frustrated, but the patient frustrated as well.
Definitely.
What other physical and psychological manifestations do you see on a daily basis from these people that have to try to cope with this?
Well, I have seen some patients who tell me that they feel like their hearing actually gets worse by the end of the day. And I've had patients ask me, like, could my hearing get worse over the course of the day? And by the time that they're ready to go to bed at night, they're like, I feel like I'm totally shutting down. And anecdotally, I've kind of expressed to them, you've been working so hard all day long that now your brain is kind of sick of filling in the gaps. One analogy I like to use with patients is, think about if you were reading a sentence and a bunch of letters from that sentence were missing. If you stare long enough, your brain can fill in the gaps, but it takes a lot of work. And patients are finding that because auditorily, their brain has to fill in all of those little gaps. To be like reading everywhere you go and whole letters are missing. That's what's happening when you have a hearing loss that's not being treated. You're walking around like that.
Dr. Lewis, what's been your experience with these types of frustrated people?
I agree with all of that. And then another thing I say to patients is, well, when you get hearing aids or some sort of amplification device, the hearing aids do that work for you. So you can just sit back, the sound comes right to you rather than you constantly reaching for the sound. So it becomes much easier to hear. You'll do better hearing too, like you'll understand the fidelity of the signal, you'll understand words more clearly, but you just can sit back and let your brain relax. So it's not nearly as straining. And I've even had patients tell me at the end of the day they feel way less exhausted by wearing hearing aids all day. They take them off, they're still tired, they're ready to go to bed, but they're not so fatigued.
Ariana, any comments?
Yeah, so I think from a lot of my patients I've heard, actually some don't really understand why they're so frustrated or even that they are tired by the end of the day. I've heard mostly the effect of hearing aids. So patients will come in after wearing them for a few months and say, okay, I think I was excessively exhausted from trying to listen. But after they have that exposure to the hearing aids, they start to understand why their frustration levels were so high, that they were fatigued. I have some patients who don't even notice that they're fatigued by listening because of their hearing loss. So the after effect is what I've noticed more. Yeah.
I like to equate it to trying to read. I know my first language is English. When I try to read something in a different language, it's another step. And it is fatiguing for somebody that's not their primary language. I think that translates. So the bottom line is fatigue, which can manifest itself in a lot of ways in the workplace, of course, as well as home, increased risk of accidents and mental errors at work, can be related to this extra effort you have to put in if you're not hearing the world around you. All right. Very good. So next, we're going to go to Dr. Lewis.
Okay. So I have an article about the efficacy of hearing aids for emotional and auditory tinnitus issues. So tinnitus is defined as a phantom sound. It's a symptom that can be related to over 200 ear or systematic illnesses. So it's not so much a diagnosis, it's a symptom of so many different things. and it can disturb people's sleep, their concentration, their emotional balance, and their social interactions. So we see a lot of patients at Plymouth ENT who come in for an annoying ringing in their ears, a buzzing, hissing, whooshing. All of that would equate to something called tinnitus. So what this study looked at is if we can help tinnitus by putting on hearing aids. So we know that tinnitus can affect sufferers' quality of life as well as their families, bringing severe emotional disorders on in extreme cases. So, and also according to the study, 85 to 96% of patients who have tinnitus also have some sort of hearing loss. So if you came into our office saying that you have ringing in your ears, we would do a hearing test to establish what your hearing looks like. And in some cases, even just putting hearing aids on, in some cases, the mere amplification of environmental noise around you significantly reduces the tinnitus perception with immediate relief. So we've put hearing aids on patients and they automatically notice a difference in the ringing and how loud it is in their ears. So this study also looks at tinnitus retraining therapy. So that's something where if you hear your tinnitus and it affects a certain part of your brain, it can also affect your emotional part of your brain, and then you correlate these two, so it can become really stressful when you hear the sound in your ear. So part of it is also retraining the brain that when you hear the tinnitus to not get stressed out about it, which is easier said than done. But when we put hearing aids on, we can turn up your noise floor or turn up everything around you, and that helps drown out the tinnitus the more that you wear them. So in this study, there were a group of people who had hearing loss, and they took a questionnaire about their emotional issues, effects on hearing, and their quality of sleep with their tinnitus. They wore the hearing aids for 3 months, and after that, they were asked the questions again. There was a significant decrease in how much the tinnitus was affecting their quality of life. So before they wore the hearing aids, in concentration, it was a 37% effect on their life, 35% in emotional, and 41% on hearing. They were having trouble hearing with their emotions and concentration. After the hearing aids were worn for 3 months, they were able to concentrate better, down to 23%, 26% with emotion, and 25% with hearing. So we do help you hear better with the hearing aids, but it also really helps with making the tinnitus less bothersome in each of your ears. One thing that they did note is that if we use a hearing aid that goes behind your ear with an open piece in your ear, that also helps with the tinnitus because we're not occluding your ear canal. I think there's this common misconception that these little tiny hearing aids are better than the ones that go behind your ear, but especially with tinnitus, if we can put a little piece that has a lot of ventilation in it to let them still use their hearing that might be normal, that helps reduce the tinnitus.
So these are sub-threshold amplifications trying to reduce the difference between the tinnitus and the ambient
They can
noise.
be. They can be. So even if someone has normal hearing, if we put hearing aids in their ears and we turn things up around them, it can help reduce the severity of the tinnitus.
Mm-hmm.
And some of the hearing aids have a specific tinnitus therapy option. So it's a recent hearing aid had some tinnitus features through the same hearing aids. So even normal hearing people have some difficulty with the tinnitus or suffering from tinnitus. They may come to us and then we can evaluate with the tinnitus features if it work for them.
So that's a relatively recent change in our armamentarium for this treatment, where we, not too long ago, we were using cognitive behavioral therapy as the primary modality for tinnitus. Now, with the new technologies we've come across the last, 5 or 6 years, it seems like the hearing aids have supplanted cognitive behavioral therapy as our primary modality for effective treatment of tinnitus. Or you guys agree?
Yeah, just
I
still
agree.
working with the cognitive behavioral therapy, just
Right.
still working for most of patients, most of people. But the hearing aid option using tinnitus therapy, it's really working well. It's not everybody 100% beneficial, but it's very good beneficial for most of my patients so far.
I think we're using more and more, it seems like we're using the CPT, cognitive behavioral therapy for tinnitus-T, as an adjunct now, add-on to the amplification. Ari, what do you think?
Yeah. I do think using both simultaneously is probably the best tactic because tinnitus has shown to affect mental health so drastically. It's important to have a mental health expert in the group of care providers for that patient, just because we are not trained in that. So having that in addition to extra devices and supports that can help manage it, so that in those moments where you feel helpless, where you feel like it's overpowering, you have multiple avenues of support, I think is the most powerful thing. So I think using both is way more powerful than just using one on its own. But with hearing aids, it's and tinnitus, you really have to try to know. You have to be open to the process. You have to see how it affects you individually because it is person dependent. It is tinnitus dependent because tinnitus can cover so many different types of sound. So it is a process that you have to be open to, and it has to kind of be exploratory.
And it also doesn't happen immediately. You could put hearing aids in your ears, you have tinnitus. Initially, you might notice some relief, but it can take up to 9 months for you to actually notice some relief. Usually we see it sooner than that. That's an extreme case. But you get a trial period with hearing aids at our office anyway. So if you don't notice a relief, you would return them. But it is an option for you to turn things up, especially if you have a hearing loss, because if you have a high frequency hearing loss, you likely have high frequency tinnitus. So we turn things up in those higher pitches for you, masking out your tinnitus just by wearing hearing aids throughout your day. Because we turn those higher frequencies up, the brain isn't distracted by that high pitched ringing, and then over time, you just stop focusing on it.
Colleen, any
Yeah,
comments?
I think I've had some, to speak to that point, I've had some patients who think, I'm going to put hearing aids on and boom, that noise is going to be gone, instant peace. And it's important that people don't get discouraged that you put them on and you're like, well, I can still hear this sound. That's okay. It takes time because really the goal here is stimulating the brain, stimulating all of those really important pathways from the ear up to the brain, and kind of teaching the brain that sound's not scary. Sound isn't scary. You can relax. So it is a process.
And I should have asked Dr. Jennifer Robinson to be here too. She's our PhD psychologist who runs the cognitive behavioral therapy part of this. But we know that there's comorbid conditions and including anxiety and tinnitus that go together. What causes the tinnitus? Does anxiety make tinnitus worse? Does the tinnitus make the anxiety worse? It's always a question. Insomnia certainly precipitates worse tinnitus, and similarly, tinnitus often precipitates insomnia. Tinnitus in and of itself has been measured as a key to overall brain health. And we know that patients with poor brain health, either from ischemic or focal neurologic disease, can have underlying tinnitus. And we never just treat tinnitus without looking for underlying pathologies. A lot of underlying pathologies that cause tinnitus, as we know, right? Acoustic tumors, that's part of our differential. There's a bunch of screening methodology we do, including some blood work to rule out the more common things. So it's always a diagnosis of exclusion for us, the dysfunction of the inner ear at the end of the day, that we come to the treatment part of it. But certainly a debilitating condition that I think a lot of people have a misconception that there's nothing can be done. There's lots of things we can do now that we haven't, tools we haven't had in the past, and things we want to make people aware of that, we can make a difference, and it's not just all snake oil.
Yeah.
Okay, so who's next? Colleen, maybe?
Sure. So the article that I want to bring to the table, it's actually out of Australia. So you took us to Germany, I'll take us to Australia.
Yeah, I love this article. I didn't realize, I forgot that Tasmania was part of Australia.
Yeah, so Tasmania, you think, well, it's just wildlife there, right? Well, the idea with picking Tasmania specifically.
I've got a question before you start.
Yes.
Are Tasmanians considered average people? Because I have no interaction with Tasmanians.
I think
Have
they're
you ever been
average.
to Tasmania?
I haven't been to Tasmania, no. But an interesting thing about Tasmania is that it has the highest population of people 50 or above in Australia as a whole.
Really?
So that is why this cohort study called the Island Cohort is being done specifically in Tasmania. Reading it, I kind of thought to myself, it's like the Florida of Australia, right? A lot of these older adults, and that's primarily who we work with on a daily basis. So they're looking at the Island Cohort, and that started in 2019, and it's going to run until 2029. And their main focus is a pretty hot topic, which is dementia risk factors. And more is going to come out of that study. But early on, specifically here, they're looking at the association between treated versus untreated hearing loss and its link with social support, social isolation, anxiety, and depression. So we know that it's well documented that depression, anxiety, poor social support, those things are all independently linked to cognitive decline. And then there's more research being done to suggest that untreated hearing loss is also linked to cognitive decline. So this is kind of bridging the gap between untreated hearing loss and some of those social factors. And I know, Dr. Glide, you'll go into a little bit more of the cognitive decline side of it. So one thing that these authors point out in their introduction, I really like this quote, is that untreated hearing loss is associated with degeneration of neuropathology mechanisms involved in auditory perception and emotional regulation. So untreated hearing loss, there's actual pathological changes in the brain that are happening both in the auditory perception areas, but also your emotional well-being areas. So in this study, participants self-reported as having hearing loss, no hearing loss, corrected hearing loss, wearing a hearing aid or two, versus uncorrected hearing loss. And the participants took the Lubin Social Network Scale, and that specifically looks at their perceived social isolation and how much social support they feel they have. And then they also looked at the Hospital Depression Scale, which is a marker of depression, okay? So they found that in the group with hearing loss, that was significantly associated with both size and supportiveness on the social network scale. So those who had a hearing loss, they felt they had less of a support network, and they were also associated with anxiety and depression. So those who had the hearing loss had those elevated anxious symptoms, the elevated depressive symptoms. And they found that those who were correcting their hearing loss, in some ways, there was a mitigation of that isolation and that anxiety. And I really like this quote: hearing loss can lead to reduced social activity, an individual's perception of supportiveness within social networks. This could lead to social withdrawal and social and emotional loneliness. So when we're thinking about the whole health of a person, you know, your mental health is also extremely important when you're thinking about your brain health as you get older. So there's ongoing work to be done, but we know that wearing a hearing aid can help reduce some of these risks for emotional, social issues. So I want that to be a main takeaway for patients. It's not, you know, not just the doom and gloom of if I don't wear a hearing aid, I'm going to get cognitive decline. Think about the positives too, how a hearing aid can help you feel connected to the people around you, how a hearing aid can help you stay active in the things you like to do, and how a hearing aid can make you feel more alert when you're at home, especially if you live alone. Think about all of those things together if you're considering, you know, where you're going to go next in your hearing health journey. Think about all of those parts of your life too, because it's all really important to consider.
And we know there's a lot of filamentous, anyway, connections between the cranial nerves and the limbic system. this interaction between depression surprised me a little bit about that direct mitigation
Yeah.
for the depression in and of itself. You guys want to chime in on any of this?
Well, I think a misconception is that not wearing hearing aids doesn't stimulate. I mean, it does not. So people come
I
in.
know where you're going with
you
this.
know,
So we know that in children, for instance,
Right.
if you don't excite the auditory system
Right.
when you're developing it, it never develops.
Right.
So it seems like there's some holdover from that to adults as well.
Right.
Right.
And there is, but I think a big part of it is not engaging in your social life if you can't hear. You don't want to keep asking people to repeat themselves. You don't want to laugh at something just because everyone else is laughing, but because you didn't hear the joke. So we want people to stay part of
know.
conversations, stay active socially, and that really helps keep your brain active too.
There is that peer pressure not to keep interrupting people.
Right.
Like when the new medical record people try to educate old physicians on how to adapt to the new medical record.
Right.
You don't want to interrupt the teacher who's got 4 other people going
Right.
because you're falling behind, perhaps.
So you nod and smile.
No, there's
get
that
caught.
social
Yeah.
pressure not to do it.
Yeah.
Right. I do think it's also important, when you're talking about someone with hearing loss and having that social isolation and the kind of lack of communication they have with their loved ones. Research has shown that big D deaf individuals, they use sign language to communicate. They have a communication outlet. There is not actually an adverse effect on their cognition because they have social interaction, they have communication.
Okay.
So having the ability to participate and communicate with your loved ones, that is the impact. Because again, the big D deaf community doesn't have the same results as adults who are hearing, who lose their hearing gradually over time. It's very different between those populations. And the difference is one has an ability to communicate, not as isolated, and the other one withdraws socially. So I think that's also important to think about. It's just the fact that they don't communicate as much.
Not necessarily because it's hearing, it's just they can't
Right.
communicate.
Right.
Yeah, yeah.
I also think about anxiety specifically. Sometimes my patients who are getting older, I do find that they're a little bit more nervous about things. And I think about if you're living alone, for example, just your awareness of stuff around you. Is somebody at the door? Are there sounds in my environment? And if you've got a hearing loss and you're not aware of certain things, it makes sense that you're more nervous, right? So wearing a hearing aid can help with that too, a little bit more awareness of some of those environmental sounds to help cue you and help you feel safe in your home.
You must see that a lot, Dr. Wan. I know you have a lot of elderly patients that you
Yeah.
spend a lot of time with from an anxiety standpoint when they first get their new hearing aids.
Absolutely. The people, actually elderly people with the hearing loss, it feels like actually they want to be participating in conversation, but actually family and friends not actually understand them. They feel like they not understanding them. So the people ask to repeat themselves, but it keep going, and the family and friends are tired to repeat themselves as well.
Yeah.
And it's gonna make actually our patients feel anxious and I'm not be in the group, so it's more isolated. Yeah.
Okay, Ari, that brings us to you.
All right. So I'm bringing us back to the U.S. So the study that I am going to discuss today is called Hearing Intervention versus Health Education Control to Reduce Cognitive Decline in Older Adults with Hearing Loss. It's also called the ACHIEVE study, which is probably easier to remember. So ACHIEVE study. It's a multi-center randomized controlled trial that was done in the United States. And it was actually just released in 2023. So this is very recent. And it was done at Johns Hopkins University in the US. So pretty notable. So this article is, I guess the first thing I want to bring up is that it's pretty groundbreaking. This study is the first randomized controlled study looking at hearing aids and cognitive decline. We've had a lot of research in the past that's been observational data, but this is the first experiment to come. So What's nice about this one, it actually occurred over a 3-year period. COVID was in there, so COVID affected their findings quite a bit. They had 977 participants between the ages of 70 and 84. They all had hearing loss, bilateral hearing loss. They were free from substantial cognitive impairment when the study began, and they had to have speech understanding scores of greater than 60%. They also had to be fluent in English. So these are all criteria that they had for participants in their study. They essentially had 2 groups of participants for this study. So they had one randomized group that got hearing intervention, and they also had one randomized group that was kind of counseled in a course on successful aging. So probably, I'm assuming that course included a lot of information that Dr. O'Dwyer already spoke on. So again, one group got hearing aids, one group was educated. And they were looking at the difference between those 2 groups and the impact it had on their cognitive decline.
Educated, but no hearing aids.
No hearing aids, exactly. So one group had hearing aids, one group did not. They were just educated on topics of aging. So with this study, it was pretty interesting. You know, it did require a team, an audiologist, a neuropsychologist. So there was quite a group working together to look at the outcomes of this study. What they found was in the population that was more at risk for cognitive decline, hearing aids had quite a bit of an impact on their rate of cognitive decline. They saw a 48% decrease in their cognitive decline, the individuals who had hearing aids versus the individuals who did not. And again, this is in a particular population. They did lots of essentially surveys to understand different kind of competing factors for participants. Like they found the participants that were more likely to have this effect had more risk for cardiovascular health issues. So they had other predisposed factors that made them more likely to have cognitive decline, and they found that population benefited the most from hearing aids. Let's see.
So the population that didn't have those increased risk factors for cognitive decline, did they also benefit from?
So the population that did not have hearing aids?
No. The population that did not have the risk factors for cognitive decline but did have the hearing aids.
So the population that did have hearing aids but didn't have any of those competing risk factors, they didn't find that hearing aids were actually they didn't modify the rate of decline.
Okay.
But for the participants that were at risk with other comorbidities, they were older, they had cardiovascular health issues, they also had lower degrees of education. They found that the populations that were more at risk for cognitive decline benefited from hearing aid use.
So you could potentially postulate that if you have increased cardiovascular disease, you may have increased cerebrovascular disease, and they may have some brain ischemic changes, perhaps, that would potentially put them at higher risk.
Exactly.
Yeah. And it's interesting about the education issue. So if you're well educated and you can't hear, you might decipher some other form of communication, like you were talking about earlier, the deaf population using sign language, so they could still communicate even though they couldn't hear and they didn't decline so much. So these other people might use, I'm thinking of autistic children who use talking boards, to communicate because they can't speak, or even younger children who use sign because they can't talk yet.
Right. Right. And I think the most important thing is having a way to communicate does make a huge impact on how the brain actually changes over time, and that's a big takeaway. But I do think if you are someone you're more at risk for cognitive decline, even if it's in your family history, if you do have one of those other comorbidities like heart conditions, or sometimes they say high blood pressure too can affect it.
I was just going to ask you, I hate to put you on the spot, because I didn't dissect every word out of this.
No, that's
so
okay.
but the population who is at increased risk, I know there cardiovascular disease, hypertension. Were they anything else? Were they diabetics? Were they?
Let me see. I know I highlighted it somewhere. Okay, so what they said was on average, the participants that showed to have higher risk factors for cognitive decline were older, female, Black, have lower education and income, have higher rates of diabetes and hypertension, and they often live alone. So those are a variety of factors they found were pretty common in the group that actually had a pretty substantial impact of wearing hearing aids for their cognitive decline.
Interesting.
Yeah.
Well, that was a landmark article, Ari. Thank you. That was very, I think, apropos for today's population.
Yeah.
First time I've seen it in a randomized control form that we can really take home.
Yeah, and they did say, you know, this was 3 years that they took this data over 3 years. They met with them on an annual basis, but they did imply at the end of the article that they're continuing to collect data to do a more longitudinal study. 3 years sounds pretty long to me, but I don't know, I'm not in the research world. So I think 3 years is pretty good even with COVID involved too. But they're looking to get more information over time, and we definitely need to see more randomized controlled studies looking at this topic. You know, and I did find in the introduction, they say a statistic that's pretty shocking. You know, it says the global burden of dementia will increase rapidly over the next 30 years because of the aging world population. Over 150 million individuals are projected to be living with dementia by 2050. So,
of course, that's a broad statement because dementia is not one thing to one person. It's over a number of brain pathologies, all lumped into that category.
I also had like a little extra article. It's not quite an article. It's kind of like commentary. So there's one, I think it was a physician who wrote this article, essentially talking about how we need to discuss hearing loss and the potential link with dementia with patients, but also how can loved ones also discuss it with their loved ones who have hearing loss. And his big takeaway is really that you don't want to scare them. You don't want to cause extra anxiety. And he even mentioned, you know, maybe don't even bring up the word dementia in the conversation, but highlight that hearing and cognitive health are very much so linked. And if one is being affected, it's important to check both. So it's important when you're talking with your loved ones not to increase their anxiety, which already may be high, as we know from what you said, Dr. O'Dwyer.
Yeah, it can be a very delicate subject to breach. I think that's probably a good way to do it.
Yeah.
Any comments, Meg, about that?
Well, I think it's interesting that on average it takes patients 7 to 10 years to come in to even get their hearing tested once they start noticing a challenge in conversation. And I think your family's conversations with you probably has something to do with it, but broaching the topic sensitively.
Yeah. All right, great articles. Any last comments, ladies, from any of those particular topics? We've talked about how hearing impairment, certainly, there seems to be great evidence now that it's linked probably in a comorbid way to dementia and cognitive impairment. The back and forth between tinnitus, anxiety, insomnia, and overall brain health, and ways we can make differences in kind of both those basic things, I think, at this point. All right, well, thank you all for coming, and it's been a great discussion, and we'll see you soon.